Welcome to our deep dive, everyone. Today it's all about a particularly tricky topic for rabbit owners. Encephalitozoon cuniculi, or E-cuniculi for short.
Right, we're diving deep into a recent international survey of vets who treat rabbits for this parasite.
Exactly, and we'll be pulling out some key insights that can hopefully help you understand this complex condition a bit better.
It's more than just textbook stuff here. We have data from over 300 vets across 36 countries.
Wow, so we're getting a real global perspective then.
Exactly, a real-world view of how E. cuniculi is actually being diagnosed and treated.
Okay, so let's set the stage here. Who exactly responded to this survey?
Well, as you might expect, most of them were exotic animal specialists.
Makes sense.
But we also had some input from small animal vets, too.
Interesting. And geographically?
Geographically, it was pretty diverse. Almost half were from the U.S., with the rest spread across the globe.
So Europe, Canada, Asia, all represented.
And beyond. And that's actually where things start to get interesting. The survey found a much higher percentage of suspected E. cuniculi cases among vets outside the U.S.
Oh, that is interesting. Why might that be, do you think?
That's the million-dollar question. Could be differences in rabbit populations, maybe access to diagnostic tools varies from place to place, or perhaps even different strains of the parasite are circulating in different regions.
It really makes you wonder, doesn't it? Are we potentially looking at regional variations in how E. cuniculi presents itself too? Speaking of which, let's talk about that classic sign, head tilt.
Ah, yes, the head tilt. The survey showed it was a big red flag for E. cuniculi, but not a slam dunk.
Not a slam dunk.
Nope. Ear infections were high on the list of possible culprits, too, both otitis media and interna.
Oh, so a rabbit could have an ear infection and E. cuniculi at the same time.
Absolutely. In fact, vets reported seeing head tilt caused by both simultaneously fairly often.
So what you're saying is if a rabbit has a head tilt, it doesn't automatically mean it's E. cuniculi.
Exactly. Thorough diagnosis is key here. We can't just assume. Vets also considered other things like tumors or even other parasitic infections.
Wow. It sounds like there's a whole differential diagnosis list for head tilt in rabbits.
Absolutely. Encephalitis and meningitis even came up as possibilities. It's a reminder that we need to look at the whole picture, not just one symptom in isolation.
So we've got the head tilt, but were there other clinical signs that vets were seeing?
Oh, definitely. Neurological issues overall were the most common, not surprisingly.
Okay, so things like balance problems in addition to the head tilt.
Yes, everything from balance issues to more severe neurological deficits, you name it. But they also saw eye problems, particularly in younger rabbits.
Makes sense. And then there was that, what was it, GI stasis?
You got it, GI stasis. Now that one's a bit controversial.
It is. Why is that?
Well, some vets think E. cuniculi can trigger GI stasis even without those classic neurological or eye signs.
Interesting. But not everyone agrees.
Right. Other vets are more skeptical about that link. And the survey results really reflect this debate. You can see a range of opinions within the veterinary community.
So we got these various symptoms then. But does the rabbit's age play a role in what they're most likely to experience?
You know, that's another point where there is some disagreement. U.S. vets seem to think older rabbits were more likely to have E. cuniculi problems.
But vets in other parts of the world didn't agree.
No, they pointed to younger bunnies being more at risk.
Wow, quite a difference of opinion then.
Yeah.
And what did the actual survey results tell us about this whole age thing?
Well, they actually supported both sides to some extent.
Oh, how so?
Younger rabbits, DD, present more often with neurological problems and eye issues, while older rabbits had more neurological problems and kidney issues.
Okay. So age does seem to matter, but the specific problems might change as a rabbit gets older.
Exactly. And I think that's what makes this deep dive so fascinating, you know?
I get.
We're seeing where there's agreement, where there are differing opinions, and even where there's still debate.
It's a real glimpse into the complexities of E. cuniculi in the real world.
Exactly.
Okay, so we've covered who responded to the survey, the various clinical signs, and how age might play a role. But what about treatment? What are vets actually doing to tackle this parasite?
Well, the most common treatment reported was fenbendazole.
Fenbendazole.
Often combined with meloxicam for pain relief.
Makes sense. So a two-pronged approach.
But even when it comes to treatment, we see those geographical differences popping up again.
Really? So tell us, what are some of those key differences between how U.S. vets and vets in other parts of the world are approaching treatment?
Well, U.S. vets were more likely to use Meclizine for dizziness, oxybendazole, which is another anti-parasitic drug, antibiotics, and even ponazuril.
Poneglyph. Isn't that usually used for other types of parasites?
You're right, it is. But some vets are using it for E. cuniculi.
Interesting. What about vets outside the U.S.?
They leaned more towards albendazole, steroids, and general analgesics for pain management.
So different tools in the toolbox, so to speak.
Exactly.
But does the survey tell us anything about which of these approaches are actually most effective?
That's the burning question, isn't it?
It is, because at the end of the day, that's what matters most for rabbit owners, right?
You're absolutely right, and this is where we hit a bit of a wall. Some treatment choices, like using Poneglyph for E. cuniculi, are based more on anecdotal evidence and experience than hard science.
Ah, I see. So more research is needed.
Absolutely. We need more data to confidently say what works best and for which specific presentations of the disease.
It's a good reminder that even with a parasite that's been around for a while, like E. cuniculi, there's still a lot we're learning and fine-tuning in terms of diagnosis and treatment.
Exactly. And that's why it's so important for rabbit owners to stay informed, ask questions, and really have that open communication with their vets. It's a team effort.
Couldn't agree more. Welcome back to our deep dive into the world of E. cuniculi. We left off talking about treatment, but now let's delve into the challenges of actually diagnosing this tricky parasite.
Yeah, diagnosis can be a real head-scratcher. The survey confirmed that vets always start with a good old-fashioned physical exam.
Of course, hands-on is always important.
But the use of things like blood tests, imaging, and PCR testing, well, that varied a lot.
Oh, really? Why is that? I mean, if we have those tests, shouldn't they give us clear answers?
It would be nice, wouldn't it? But it's not quite that simple. Physical exams are great, but they can't always pinpoint E. cuniculi, especially early on.
Right, especially if the symptoms aren't super obvious yet.
Exactly. And as we've discussed, those E. cuniculi symptoms can look like so many other things.
So it's not just a case of spot the head tilt, we've got our answer.
No, not at all. It really underscores the importance of ruling other things out.
Okay, so physical exams alone aren't enough. What are those other tests then? Blood tests, imaging, PCR? What did the survey tell us about how vets are using them?
Well, it seems like there are a few factors at play. Things like cost and availability certainly influence a vet's decision.
Makes sense. Not every clinic has access to every test.
Exactly. The survey found that serology, which checks for antibodies in the blood, was more common in the U.S., probably because of better access to labs there.
But if I remember correctly, you mentioned earlier that a positive antibody test doesn't necessarily equal an active infection.
That's right. Serology can tell us if a rabbit has been exposed to E. cuniculi at some point, but it can't tell us if that's a past exposure or an active infection right now.
So it's a piece of the puzzle, but not the whole picture.
A good analogy.
What about imaging then? Can't we just get a scan and see the parasite?
If only it were that easy. Imaging, like MRI or CT scans, can be helpful for ruling out other conditions like tumors or strokes.
So it's more about eliminating other possibilities.
Exactly. But those scans can't actually visualize the parasite itself. It's about looking for patterns of damage that are consistent with what we know about E. cuniculi infection.
Okay, so imaging helps us narrow things down, but again, not a definitive answer. What about PCR testing then? That's the one that actually detects the parasite's DNA, right?
You're right. PCR can be very accurate, but it requires very specific samples, cerebrospinal fluid or urine, for example.
And those aren't always easy to get from a rabbit.
You got it. Plus, the sensitivity of PCR can vary depending on the type of sample and how far along the infection is.
It sounds like even our most high-tech diagnostic tools have their limits.
They do.
The survey also mentioned necropsy, which I know is examining the body after death. Is that the only way to get a 100% certain diagnosis?
Unfortunately, yes. Necropsy lets us see the tissues in detail and often gives us a definitive answer.
But of course, that's not something most owners would choose to do.
Right. It's a difficult ethical decision and, understandably, not a routine procedure.
It really makes you appreciate how tricky diagnosing E. cuniculi can be.
It does. It's about using all the information we have, history, physical exam, test results, and putting those pieces together to get the most likely diagnosis.
Like a veterinary detective.
Exactly.
Okay, so we've covered the ins and outs of diagnosis, but the survey also touched on some other interesting aspects of E. cuniculi, things like the role of stress and even vaccination.
Right. Those are some intriguing areas for sure.
Let's shift gears a bit and explore those. What did the survey tell us about stress and E. cuniculi?
Well, most of the vets who responded believe that stress can make E. cuniculi problems worse, maybe even trigger a relapse.
That makes sense, doesn't it? Stress weakens the immune system, so the body can't fight off infection as effectively.
Exactly. It really supports the idea that a lot of rabbits could be carrying E. cuniculi without showing any signs, as long as their immune system keeps it in check.
So it's kind of lying dormant, waiting for an opportunity.
A good way to put it. Now, the connection to vaccination, that's a bit more controversial.
It is. Tell me more about that.
Well, a lot more vets outside the U.S. reported seeing E. cuniculi symptoms show up after vaccination, especially the vaccine for rabbit hemorrhagic disease virus, or RHDV.
Oh, so that raises the question, is the vaccine itself causing the problem?
That's the million-dollar question. It's possible that the stress of getting vaccinated, even if it's temporary, could be enough to tip the scales for some rabbits, giving E. cuniculi a chance to take hold.
I see. So their defenses are down, and the parasite takes advantage.
Right. But it's also possible that it's just a coincidence. Maybe the rabbit was already infected and would have shown symptoms anyway.
It's hard to say for sure then.
Exactly. We need more research to really understand this relationship between vaccination and E. cuniculi.
It seems like there are still so many unknowns when it comes to this parasite.
There are, but one thing that's clear is that a holistic approach to rabbit health is really important.
I agree.
It's not just about treating the parasite, it's about supporting the rabbit's overall well-being, making sure they're as healthy as possible to resist infection.
Absolutely. A healthy rabbit is a stronger rabbit. And speaking of a holistic perspective, the survey also asked vets about something that might surprise a lot of listeners: the zoonotic potential of E. cuniculi.
Oh, right. Can humans actually catch this parasite from their rabbit?
Exactly. What does the survey reveal about that?
Well, very few vets in the survey were even aware that this was a possibility.
Really? That's surprising.
It is. But while transmission from rabbits to humans is relatively rare, it can happen, especially in people who have weakened immune systems.
So it's not something to be overly worried about, but it's good to be aware of.
Exactly. It's always wise to practice good hygiene when you're handling any animal, really. Wash your hands thoroughly after interacting with your rabbit, especially if you know they're infected. And if you have any concerns about your own health, talk to your doctor.
Good advice. It's a good reminder that the health of our pets and our own health are interconnected. This deep dive has really opened my eyes to so many different facets of E. cuniculi.
Me too. We've gone from the very practical aspects of diagnosis and treatment to these broader ideas of stress, immunity, and even the potential for human infection.
And it all started with just one survey of vets. It's amazing how much information we've been able to unpack.
It really highlights both how much we know about E. cuniculi and how much we still need to figure out. There's still so much to learn, and ongoing research is crucial.
Absolutely.
Yeah.
But even with those uncertainties, one thing is crystal clear. Vets are incredibly dedicated to finding the best ways to care for rabbits affected by this parasite.
They are, and they're always trying to improve their understanding and treatment strategies.
And we as rabbit owners can play a role too, right? By staying informed, asking questions, and working together with our vets to make sure our bunnies get the best care possible.
I couldn't agree more. That's the key takeaway here. Partnership and proactive care.
And we're back for the final part of our deep dive into E. cuniculi in rabbits.
We've covered a lot, haven't we?
We have. We've talked about symptoms, diagnosis, treatment, even the possibility of humans getting infected.
Right, so now let's bring it all home.
Exactly. What can rabbit owners actually do to protect their bunnies from this parasite?
That's the key question, isn't it? And the good news is there are things you can do, things to reduce the risk and things to help your rabbit even if they do get infected.
Okay, so break it down for us. What's the first line of defense?
Hygiene.
Hygiene.
It might sound simple, but trust me, it's absolutely crucial.
Okay, tell me more.
So E. cuniculi is spread through spores that are shed in the urine. And these spores can hang around in the environment for quite a while.
I see. So keeping things clean is super important.
Absolutely. That means litter boxes, cages, even those play areas, it all needs to be cleaned regularly.
And what's regularly?
Well, it depends on how many rabbits you have, how messy they are. But in general, at least once a week is a good starting point. And you need to use a disinfectant that's effective against those microsporidian spores.
Okay, so not just any old cleaner will do.
Right. And remember, rabbits are constantly grooming themselves, so anything in their environment can end up being ingested.
Makes sense. So clean cages, clean toys, clean everything.
Yeah.
What else can we do to minimize the risk?
Well, think about where you're getting your rabbit from. Reputable breeders and shelters should be screening their rabbits for E. cuniculi.
So do your research before bringing a new bunny home.
Exactly. Ask questions. Make sure they're taking steps to minimize the risk of infection.
And what if you're introducing a new rabbit to a home where you already have rabbits?
Quarantine is key.
Okay, so how long should you quarantine a new rabbit?
A couple of weeks is a good rule of thumb.
And that's to observe them for any signs of illness and prevent potential spread, right?
Exactly.
Okay, quarantine.
Yeah.
Got it. Now, what about diet and lifestyle? Can those play a role in prevention?
Absolutely. A healthy rabbit is much better equipped to fight off any infection, including E. cuniculi. So a diet that's high in hay is essential.
Hay is king, right?
Absolutely. Along with fresh vegetables, a limited amount of pellets, plenty of exercise, and mental stimulation.
So a happy, healthy bunny is a stronger bunny.
Exactly. But even with the best preventative measures, some rabbits might still become infected.
And that's where things get tricky.
Right, but that's also where working closely with your vet is so important.
Regular checkups.
Yes, regular checkups can help catch those early signs, and starting treatment early can make a world of difference.
And as we've learned, those early signs might not always be super obvious.
No, they can be subtle. So it's really about paying close attention to your rabbit, noticing any changes in their behavior.
Okay, so what kinds of changes should we be looking for?
Any neurological signs, for starters? Things like head tilt, loss of balance, weakness, seizures, any of that.
Right, and we've talked about those already.
Also, keep an eye out for any eye problems.
Like what?
Cloudiness, redness, discharge, anything unusual.
Okay, eyes. Anything else?
And even though the link between E. cuniculi and GI stasis is still debated, don't ignore any digestive issues either.
So if you notice anything unusual, it's best to err on the side of caution.
Absolutely. Get in touch with your vet. It's always better to be safe than sorry.
We've covered so much ground in this deep dive. I feel like I've learned a ton.
Me too. We've really explored the complexities of E. cuniculi, haven't we?
We have. From diagnosis and treatment to stress and immunity, and even the potential for human infection.
It's amazing to think that all of this stemmed from one survey of vets.
It really shows the power of collaboration, doesn't it?
It does, and it highlights both how much we know about E. cuniculi and how much we still need to learn.
Right. There's always more research to be done, always more questions to ask.
Exactly. But what's clear is that vets are dedicated to improving how we care for rabbits affected by E. cuniculi.
And that gives me hope.
Me too. And by staying informed, by asking those questions, by working together with our vets, we as rabbit owners can make sure our bunnies are getting the best possible care.
That's a great message to end on. A huge thank you to all the vets who participated in this survey and shared their expertise.
And to all the rabbit owners out there, keep learning, keep asking questions, and keep advocating for your bunnies. They're worth it.
Couldn't agree more. From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.